According to the Justice Department's final sentencing release, eSimple Health sales script promised customers they would owe pennies on the dollar. According to the Federal Trade Commission complaint, a typical product might pay only $100 per day toward a hospital stay. The Justice Department's release says eSimple Health sold limited indemnity plans to more than 400,000 consumers and generated more than $190 million in revenue. Customers were told the plans would function like major medical insurance. Once the policies reached their payment caps, the customer was responsible for the rest. The business worked beautifully at the call center end of the transaction. The problem appeared when someone actually needed medical care. eSimple Health was a South Florida telemarketing company owned and operated by Stephen Dorfman. The Justice Department said the company sold the policies across the country from May 2012 through November 2018. The central product was a limited indemnity plan. Unlike comprehensive insurance that absorbs a substantial share of covered healthcare costs, this kind of plan pays fixed, relatively low amounts for particular services. The name sounds technical. The financial result is simple. A benefit can stop while the bill keeps growing. According to evidence presented at Dorfman's trial, eSimple Health trained its employees to sell those limited benefits through deceptive tactics. The customer journey often began online. According to the Federal Trade Commission's complaint filed on November 2, 2018, eSimple Health and related companies marketed limited benefit plans and medical discount memberships through numerous websites. The complaint alleged that promotional material claimed to offer products from leading insurance carriers. Other sites used terms associated with the Affordable Care Act and displayed logos belonging to familiar insurers. One eSimple Health lead generation site promised products from the nation's leading carriers, along with affordable premiums and prescription drug coverage. A person looking for ordinary health insurance could submit a name and telephone number. That information became a sales lead. The Federal Trade Commission complaint alleged that eSimple Health also bought consumer information from third-party lead generation websites. Those sites attracted people seeking comprehensive coverage, including policies connected to the Affordable Care Act. The call center then took over. According to the complaint, telemarketers commonly described the offer as a Preferred Provider Organization Plan, or PPO plan. They allegedly presented it as comparable to comprehensive insurance but cheaper and without deductibles. The Justice Department later said the scripts designed and implemented inside eSimple Health misled consumers about how much the policies would actually pay. The sales operation turned a complicated distinction in insurance design into a very profitable misunderstanding. The script supplied the reassurance. According to the Justice Department's sentencing release, eSimple Health salespeople were directed to use statements including, "The whole idea of this plan is to make your out-of-pocket expenses as low as possible." Another line promised that, "When all is said and done, you'll end up owing pennies on the dollar." Evidence at trial also established that commissioned salespeople frequently added off-script lies to persuade consumers to buy. The Justice Department said Dorfman made little to no effort to stop that practice. The distinction between a fixed benefit product and major medical insurance faded beneath language engineered to sound comforting, comprehensive, and cheap. According to the Federal Trade Commission complaint, consumers who requested written plan information before purchasing were often refused. After a customer supplied a debit or credit card, the call moved to another employee for verification. The complaint alleged that salespeople sometimes instructed customers to disregard warnings that contradicted the pitch. During verification, customers faced a series of lengthy statements delivered by an employee or sent electronically. The complaint said customers were cautioned that asking a question would send them back to the sales representative and restart the process. On mobile devices, the electronic disclosures appeared as pages of small text. The verification recorded agreement. The earlier sales call shaped what the customer believed that agreement meant. The product details reveal the size of the gap. According to the Federal Trade Commission complaint, a typical limited benefit plan sold by the companies paid $50 toward a physician visit, with benefits capped at 3 visits per calendar year. It paid a maximum of $100 per day toward hospitalization. The complaint alleged that these plans provided no coverage for pre-existing medical conditions or prescription medications, despite assurances from telemarketers. Some customers also received medical discount or wellness memberships. Those memberships offered access to negotiated discounts from third parties. The listed categories extended beyond healthcare to services and products including flowers, travel, dining, movie tickets, and magazine subscriptions. An undercover transaction described in the Federal Trade Commission complaint showed how the pitch translated into actual coverage. A telemarketer sold an investigator a limited benefit plan after promising comprehensive health insurance. According to the complaint, the plan would have paid none of the cost of a routine office visit to the doctors the investigator identified as primary care providers. The investigator also asked about a diabetes medication. The telemarketer said the prescription would cost between $4 and $12. Under the product that was sold, the complaint said filling it would have required the investigator to pay between $850 and $900. The promise and the purchase existed in different financial worlds. For real customers, discovery often came with a medical bill. The Federal Trade Commission complaint said many consumers paid enrollment fees and monthly charges while believing they had comprehensive insurance. Consumers reported paying $500 or more per month. The complaint said many could not use the products for services normally covered by health insurance, and frequently learned they lacked that coverage only after incurring substantial expenses. The Justice Department's sentencing release later described the same basic outcome. Customers were promised that the policies would cover most medical expenses, then found that the plans provided little, if any, coverage when they tried to use them. The remaining bills could be substantial. The break came through the Federal Trade Commission. The Justice Department said the criminal investigation began with a referral from the Commission's Midwest Regional Office in Chicago. The Commission filed its civil complaint for injunctive relief in 2018. According to the Justice Department's final release, that action ended the fraud, and a court-appointed receiver took control of eSimple Health's operations. The paperwork that had helped complete each sale was now joined by a different paper trail: the Commission's complaint, court records, and the evidence later presented to a federal jury. The business model could be reduced to the contrast those records documented: broad promises entered through the headset, narrow benefits emerged from the policy. In February 2024, a federal jury convicted Stephen Dorfman of conspiracy to commit mail and wire fraud, 4 counts of mail fraud and 8 counts of wire fraud. The verdict followed evidence about the training, the scripts, the off-script statements, and the limited benefits customers actually received. On July 25, 2024, a federal judge sentenced Dorfman to 25 years in prison. The sentence also included 5 years of supervised release after imprisonment. By then, the Justice Department's final accounting placed eSimple Health's revenue above $190 million and the number of consumers above 400,000. Those figures measure the scale of a sales system built around one dangerous substitution: the sound of comprehensive coverage for a product that paid only limited amounts.